Good morning, everyone. Today is Thursday, September 28th. Thank you for joining into our weekly healthcare reform webinars. I'm glad that I'm hoping that you find these webinars a source of information that you can use in the field. My name is Deb Wilkinson. I'm the Vice President of the Health Plan Options Department here at URL. And, again, we've tried to stay in front of this ever-changing law, even when it was signed back in 2010. And for the most part, I think we've been pretty successful in trying to stay ahead of it. I have to admit, since January 20th, with the new administration, it's been a bit difficult because things change very, very quickly. So I had hoped to have more information or better information maybe about the Graham-Cassidy bill being signed, but that's not going to happen. It is dead on arrival. So what's next? Yesterday morning I said that's it. Everybody said that's it. They're moving on to tax reform. And Lamar Alexander, who we've talked about previously, he's a Republican from Tennessee, senator, I believe. And he's the chairman of the Senate Health Committee, and he ran the Health Committee meetings a couple weeks ago. One was with insurance commissioners, one was with the governors of several states, and then the other was with insurance carriers. So he tried to do that to get to some sort of consensus on how to move forward with stabilizing this individual market. And, so that was done because there was no consensus that could be reached, but he is now proposing an ACA repair bill. And really that will simply confirm the cost share reductions for 2018 and 2019. Can it get done with a simple majority by Saturday? Probably not. So I'm not sure how much can or can't get done. Of course, that brings us right into what carriers are going to do. If anyone attended our leaders conference, we had representatives from Geisinger and Capital Blue Cross and Highmark Blue Shield there. And essentially what they said is on the individual market, they submitted two sets of rates, one with with lower rates with the understanding that cost share reductions would be confirmed and the individual mandate would be enforced, and a set of rates that if it was still ambiguous about the cost share reductions or the individual tax penalty, and their higher rates. So I'm not sure where they're going to fall. I did read an article yesterday that said that most insurance commissioners are now approving the higher rates. So I do have a message into the insurance department here in Pennsylvania. Didn't get an answer yet, but hopefully we'll get something for you. And the rates are going to be out within the next 2-3 weeks anyway. But I'm going to try to continue to get information. I'm also talking with Capital and Highmark today and trying to see if I can read between the lines on what they're going to do. At this point, the carriers had to sign the contract to participate for 2018 in the FFM. They had to sign them yesterday. I don't know who signed and I don't know who didn't sign. I imagine that UPMC, Capital, Geisinger, Highmark, and Independence Blue Cross have signed. But again, I don't have those details yet, and I will try to get those. But I can't imagine that at least those 5 carriers would not participate. Doesn't mean they're paying commissions, but participating in the FFM. There's also a lot of networks and hospital system acquisitions, so it may be a bit tricky this year. And again, I'm going to try to get as much information as I can to get out to you guys so you are better informed. It's always a challenge when these rates don't get approved until a week, 2 weeks prior to selling, and you're expected to know all the ins and outs. So it is a challenge. Further challenges in the individual market, as we know, or maybe you don't know, open enrollment begins November 1st. The site is going to be closed the evening of the 1st, which of course is a bit of a tough situation. And it's also going to be closed 5 of the 6 Sundays that it's open, for up to 12 hours, they say, from midnight until noon. Now, if you remember, open enrollment this year is November 1st to December 15th. So it's already shortened almost by half. Now they're taking 5 of the 6 Sundays and cutting those down to essentially half days. December 10th will be open, but you know, it's going to be difficult. I did read an article where, you know, Washington thought that, you know, this is the 4th year and everybody understands that people have to purchase insurance within a certain time frame. And I kind of laughed at that because I'm sure you get questions as well on, you know, people still not understanding that there is an open enrollment period, that they can't, outside of open enrollment, just get coverage on or off marketplace. So I think it's going to be a challenge. Of course, we also already talked about the budget being reduced for advertising. So that's going to, of course, keep people under those rocks a little bit more. And of course, they reduced the funding for enrollment assistance to the navigators and the community organizations. So again, there's going to be less folks even in this market. So challenge, I think, is the word of the day, and will be with us at least through December 15th. And again, it's all a January 1st effective date. So that's it. If your clients don't enroll between 11/1 and 12/15 for a January 1st effective date and don't have a qualifying event, they are out for the year. Of course, we talked about National General and their products, their standard short-term medical products that you can, as of 1/1 effective dates, go in and enroll online for 4 consecutive policies. That means when one 89-day policy lapses or terminates because it's run its 89 days, another one will automatically start. It is a new policy, a new deductible reset, new pre-existing reset, but it is a way to essentially get your clients through all of 2018. And it does pay commission. There's additional products that you can sell within that portal. So if you are interested, please don't hesitate. We're kind of running out of time. If you want to get appointed with National General, just shoot me an email or give me a call or talk to your new business specialist, and they can let me know, and we'll get you up and running with National General. I am having a call this afternoon about a new product on the individual market. I'm not sure how viable it will be, what the commission is. It is, again, on the individual market, but sold in combination with a health share ministry. So again, that does not fit everyone. It doesn't even fit a lot of people, but it is an option that I'm going to explore. And of course, I will pass that information on to you if it's something that you know, I think won't get everyone into trouble. New age banding this year for 2018, it used to be everyone in the 0 to 20 block got the same rate. They have changed that. They're going to have a 0 to 14 rate, and then 15, 16, 17, 18, etc. Individualized rates. So I'm not sure if that's going to help or cost more. I know that children are very expensive, so lumping the older folks, you know, the 17, 18, 19-year-olds into the same block as infants probably wasn't, you know, the best move. So I'm hoping it does give some of the younger folks some relief, but with prices rising as they will, I'm not sure if they're not going to be kind of any price savings would not be absorbed by any rate increase. So again, we'll know soon. If you are a Highmark producer with us, selling on the group health side, Highmark sent out information about an elite producers reward program, and we sent that out to you, gosh, a couple months ago. There are quite a few of you that are even on this call that have points waiting for them that have not yet registered. So I will be reaching out to each of you individually that do have points and have not registered, but just for anyone out there, whether you work for URL or not, if you work with an elite general agency, you are eligible to get those points. And if you've not registered and if your general agency has not told you about it yet, you may want to reach out to them and find out what is, what the options are. Because every point can give you credit towards travel and purses and shoes and jewelry and sporting goods, sport events. So there's a lot of things within those points that you can take advantage of. I did attach the 2018 group product grid from Capital Blue Cross. If you've not attended their meetings or have not registered for the webinars, I encourage you to do that. My next bullet point is to make sure that you check in my newsletter as we move towards open enrollment and as we get further ingrained into fourth quarter. Just keep an eye on that training segment within my newsletter, because you're not going to want to miss the carriers talking about their 2018 products. So make sure you take advantage of those training sessions. And that brings us up to the end and the open forum. So if you have questions, go ahead and plug those in the question box. I did forget to mention that if you do want to ask a question, you can raise your hand on the hand icon or the control panel to the right of your screen, or you can type in your question. So I apologize for not mentioning that at the beginning of the webinar. So let's see if we have any questions. We do. Mike says, Smart Talk on WITF radio from 9 to 10, and again tonight from 7 to 8 has State Insurance Commissioner Miller talking about the ACA and issues, etc. It rebroadcasts tonight. Nothing new to us that we have not heard already. Mike, thank you. Mike says, notice that he turned it off to listen to me. So I appreciate that, Mike. I will check into that and see if I can get a recording and include that next week. And Kim said, what is the number of covered days for National General per enrollment period? It is 89 days each policy. And Alicia said she missed quite a few webinars and she has 2 questions. She's assuming that no commissions again this year. And Alicia, I have not heard definitively. I know UPMC is paying commissions, although they've cut them almost by half to $10 per member per month. But I've not heard from the other carriers. I'm pretty sure Geisinger will take the same approach they did the last 2 years and pay renewals only, if anyone has any renewals eligible within Geisinger anymore. Independents did not pay. Highmark paid on renewals only last year, and Capital only paid on renewals as well. So I'm making the assumption that that's not going to change a whole lot. If anything, I think carriers will come out and say they're not even paying renewals. But again, I've not heard that definitively, and I don't want to scare anyone. I am trying to get that information. Again, I plan calls today with Highmark and Capital, and I'm going to try to read between the lines and get as much information as I can. And again, I will pass that information on to you. So that's all of our questions for today. Please keep tuning in. Things are going to be changing even more rapidly as we get closer to 11/1. As always, I truly appreciate everyone taking a few minutes out of your busy day, especially this time of the year, to join in and keep your questions coming. We'll keep watching and looking for those opportunities for you. And as always, I appreciate your attendance, appreciate your partnership with URL, and wish you all a great balance of the week and a wonderful weekend. Bye-bye.